Hi, I'm Alicia and I'm HR advisor at Greensleeves Care, and I would like to thank you for watching this webinar and introduce Dale, who is our relationship manager from Thrive Mental Health Services, and he will be conducting this 30-minute webinar about the app and how to get the most out of it. So over to you.
Thank you so much. That's right. I'm Dale. I'm from Thrive. I'm relationship manager. And the goal here today is to help introduce you all to Thrive, to help you understand some of the tools within the app and within the service that we have to offer. And so I'm going to briefly introduce Thrive as where we've come from, what we are, why we exist. Then I'm going to jump into a bit of a demonstration of the app and the tools that you've got access to. And then following that, we'll have a little discussion at the end around sort of confidentiality and things like the things that you might want to know about your data. So to start with, Thrive is a social enterprise that was founded in 2012 by a consultant clinical psychiatrist and a consultant psychologist, both of whom had worked in the NHS and the independent sector for around a combined 40 years. And so between them had a lot of experience, and what they recognized from their own private practice, from working within the NHS, was that there was no early intervention support for mental health, and there was no signs that it was going to be coming about within the NHS. What they found is that the people they spent a lot of time working with in therapy and beyond were people who've been struggling for a very long time, and the longer that mental health struggle goes on, the worse it gets, which was unnecessary. And so they decided to think about a way they could get early intervention support and self-management psychological tools and techniques to as many people as possible. And so they decided that technology was a great route to do that. Everyone and their dog has a smartphone these days. And so you've got the opportunity to have that support just in your pocket. And so they developed the Thrive app, working with a games developer who was behind Sims and other major gaming titles, to try and create a tool which was not only for the self-management of mental health issues, but also for the early detection and prevention of mental health issues as well, with a bit of gamification to make it engaging and fun and easy to use. And since that the idea developed back in 2012, the app has been through 2 clinical trials working with a number of universities. We have become the only NHS-approved app for mental health in the entire world, and still are, even 4 or 5 years later from getting that accreditation. And we're also a company which is using research functions. We have our own research department to continually improve the app, to look at outcomes from a clinical basis, to make sure that everything within the app has a clinical reason for being there, that it's effective, that it works, and that the tools within are proven to support and help people with their mental health. And so from there, I'm gonna open up the app, because the best way to understand Thrive and to see how it can be useful to you is to see it in action. And so I'm going to do 2 things. I'm going to turn my video off because I'm going to be looking at my iPad instead now, and you don't want to watch the side of my face for the next 25 minutes. And so I'm going to go into the app on my iPad and introduce you to some of the tools and techniques within it. And so I'm going to turn my video off, and I'm going to share my screen from the app. Okay. Barring any technical hitches, you should see the Thrive app now. Brilliant. And so as you can see, the app has a number of tools within it. You can see the bar along the bottom, which contains some other tools as well I'm going to talk about. But I thought the easiest way to go through the app is to start just from the top. And so I'm going to introduce you to a number of our tools going down the app, talk a bit about where they're applicable, how you can use them in your own life. And I'm going to start with the CBT program at the top there. So CBT, or cognitive behavioural therapy, is probably the most clinically effective tool for dealing with common mental health issues that we have. It's had 40, nearly 50 years of clinical evidence to support its efficacy. And it's also an effective tool in not only dealing with anxiety, depression, and other mental health issues, but it's also an effective tool in building personal resilience and helping that prevention of the onset of those issues as well. So to explain it in a simple way, cognitive behavioural therapy focuses on the relationship between our thoughts, our emotions, and our behaviours. It helps us recognize where we make choices that perhaps aren't the best for our well-being, and helps us to make better decisions which are less emotively or reactively driven. It's focused on identifying unhealthy thought patterns, minimizing their influence, and in turn stopping the damage they can do. And so it's a self-reflective tool which enables us to put ourselves into certain scenarios, to think about how we would react, and to recognize where perhaps bad mental outcomes come from and how we can beat those thought patterns which create them. So it's very, very simple sessions that we put together. We put together about 24 mini sessions, each one 2 to 7 minutes long, each one usually presenting a certain scenario or a certain principle, and presented in a simple way. It's not presented in a university lecture style way. It's in simple language, which encourages you to be self-reflective. And so there's sessions on the thought-body connection, on how we can understand our mood, how we can use things like journaling to recognize perhaps where some unhelpful thought patterns are coming in, and enable us to identify, some of the issues that we might be experiencing. Now, the course itself, as I said, is about 24 sessions long, and I've completed it over the last 6 months. I've completed it 3 times now. Now, to do that through the NHS, which is, if you go to your GP struggling with anxiety, depression, CBT is one of the most common things you'll be pointed towards. To complete 2 courses of CBT, it would take anywhere between 18 months and 2 years to do through the NHS. But you've got the power to be able to do it at your convenience, at times that works for you. On a coffee break, you can sit and have your coffee, your cup of tea, and do a session of CBT. And so it's a portable, simple to use tool which can be effective for you and work towards your schedule as well. And so that's the CBT program. Next, I'm gonna focus on a couple of the intervention tools that we have within the app. Now, I call them that because they're there to help support you perhaps in moments where you are feeling the onset of a panic attack or anxiety or stress. And so I'm going to focus namely just on 3 of them for this session. I'm going to focus on the calm breathing, the deep muscle relaxation, and the meditation as well. And so we'll start by jumping into the calm breathing. Don't worry, I'm not going to make you all do a calm breathing session now. Just going to talk about why we put calm breathing into the app. Now, it's something you're all probably aware of. It's probably something you've told people to do in the past without even realizing, as it's that automatic response when you find somebody who's perhaps stressed or worried or struggling with anxiety. You always say, let's take a deep breath, let's calm down. And calm breathing is based on that principle that controlling your breathing, stopping it from getting away from yourself and in panic, is a great way of stopping those anxiety attacks from kicking in. So the calm breathing itself, the science behind it is that it activates what's called the parasympathetic nervous system. It slows your heart rate, increases the amount of oxygen in your blood, and activates what we call the rest and digest nervous system, the opposite of the fight or flight. You can think of it as a sticking plaster for anxiety in those moments where you do feel those panic attacks, the intense stress, or perhaps, you're feeling really nervous ahead of a big meeting, whatever it might be. Just 3 minutes of calm breathing can bring you to a state of relaxation. So you can have those clearer thoughts and not get as carried away in the stress and the worry and the anxiety. And within the app itself, you can custom how long you want to do the session for, if you need a few minutes. You can have guidance as well and effects to help assist you to concentrate on that breathing. But it's a very simple tool. It's a very simple technique, but lots of evidence to suggest that it will help support with any stress or anxiety you might be struggling with. Backing out of calm breathing, I'm going to take you into deep muscle relaxation as well. Now, this is probably my favorite tool within the app personally, partly because what we find is that males tend to prefer more body-based exercises. Not to say women don't as well, but that's just something that does appeal to me. And our deep muscle relaxation itself is a tool you can utilize to create a physiological and a psychological response to whatever it is that you've been struggling with. Perhaps you're just feeling burnt out and tired. Perhaps if you're struggling with some depression or intrusive thoughts, or whatever it might be. The idea being that you're taking on a guided tensing and relaxing of various muscle groups to help focus your mind on your body and less on the anxious thoughts you're experiencing. and to focus your body on relaxing, on tensing and relaxing those tools, recognizing those muscles, recognizing the difference between those two feelings, and creating a feeling of relaxation across the whole body. Now, deep muscle relaxation has lots of research to suggest that it's very effective in helping support sleep. And so personally, I do deep muscle relaxation just before bed. As it's proven to improve sleep, even if you feel like you're sleeping okay, but also it's been proven to help with issues like insomnia and anxiety. We often find that the mind races without external stimuli, and when you're laid in bed in a dark room with no screen, with no one to talk to, those can often be the times when those intrusive, anxious thoughts or worries start to come in. I know I often fall into the trap of replaying my day and thinking, oh, why did I say that stupid thing in the webinar earlier that day? And we get into that cycle when we're laid there without any stimuli. And so using deep muscle relaxation can stop that happening and also help support you get some good sleep. Beyond deep muscle relaxation, I'm also going to touch on the meditation. Now, the reason I wanted to talk about meditation is because I think there's a bit of a stigma attached to meditation at times. I think some people think of the word meditation and think they need to sit on the floor with their legs crossed and do some kind of humming or chanting or something like that. And meditation isn't that at all. It doesn't need to be that at all. And so within the app, we have a number of different types of meditation, which you can utilize to really help train your focus and to prevent those intrusive thoughts, to be able to clear your mind. And so some of the sessions we have include a concentration meditation, which is built to help you develop stronger focus. I know after the last sort of 18 months of being, sort of in and out of lockdowns and locked at home and mostly utilizing screens and things like that for our entertainment, I've noticed my ability to focus is somewhat diminished as I'm sort of drawn towards screens more and more, being so so locked into them. And so some concentration meditation is a great tool to help with that focus and the ability to, not just be dragged to the brightest light. We also have things like aroma meditation, which is as simple as making a cup of tea. You're encouraged to make a cup of tea, sit there and do an aroma meditation, focusing on, the smell of the tea, the warmth of the cup in your hands, and really being present in that moment, as well as things like a mindful walk, where if you want to get out the house and go for a walk, just stick an earphone in and you take it on a mindful walk where you're encouraged to focus on the rhythm of your footsteps, on the rustling of the leaves and the trees around you, and to try and focus on the things that you otherwise miss because you're looking inside, focusing on your thoughts. Or if you're anything like me, halfway through the walk, you end up pulling your phone out and pretending like you're busy on your phone. And so it's a great tool to be able to be more present, to be more focused and less distracted by intrusive or unwelcome thoughts. And so it's a really great tool and a great thing to learn over time. You're not going to be a master of meditation from one session, but it's a great tool to utilize to learn over time. We do have other sessions like the self-suggestion, applied relaxation. I'm going to allow you to explore those yourself, just in the interest of time, and also especially the applied relaxation. It's a course that you will go through to help get yourself to a state of relaxation within 30 seconds. And there's a number of sessions within there, and it is a course that you would go through to learn that tool. And so rather than take you through the ins and outs of that, I'll leave that to you to experience. But so I'm going to touch on now is going beyond those intervention tools and into the pathway to support. Now, this pathway is designed to help you get help as quickly as possible should you need it. And it's built around these two psychological tools that we have, the GAD-7 and the PHQ-9. Now, these are the same questionnaires that you would utilize with a GP or with a counselor to establish where you score on the anxiety, the GAD-7 and the depression PHQ-9 readings. And so I'm going to show you what this pathway looks like, just to take the mystery out of it and to show you how secure and easy it is to use. So each day you log into the app, you'll be invited to do that daily checkup, which has that little blue tag next to it. And so I'm going to take you through a daily checkup, what it entails, how easy it is to use, and the outcomes that can come from just a simple questionnaire. Usually it takes around 2 minutes. And so it starts with inviting you to grade your mood, and you can be as open and honest as you like about this because it's completely confidential. It's just you and your screen. You're not talking to another person. And so we'll say for the purpose of this experiment, even though I'm feeling quite good today, I'll say that I'm feeling quite low, that I'm feeling kind of grey, cloudy, rainy, and I've not had a good day. I'm then invited to utilize these mood bubbles to pick which word most closely describes how I'm feeling. And so it could be that I'm feeling quite anxious. It could be I'm feeling hopeless. If none of these words capture it, I can add a custom bubble, whatever that might be. But we'll say that today I'm feeling anxious. I'm now asked to grade how intense that feeling of anxiety is. And we'll say that it's quite intense. Now, because I've input a negative mood and that I've put that it's quite intense, I've been invited to fill out these questionnaires, the GAD-7 and the PHQ-9. And we'll, for the purposes of this, rather than go into the longer version, which is triggered as if you were to input the red circles or the orange circles, which are more negative, if it had just been a couple of days where you've been feeling quite anxious, where maybe you hadn't been able to stop worrying for the last few days, but maybe you were still finding sort of interest and pleasure in the things you were doing, and again, you weren't particularly feeling depressed or hopeless, just anxious, the questionnaire would be shorter, because it's evident that you're not struggling with more intense feelings of anxiety and depression. And so doing that scale, that what has actually come out is that while I am feeling anxious right now, it's not indicative of a mental health disorder, that it might be that actually something bad has happened which has caused that anxiety. Perhaps I've fallen out with a partner or struggling at work or whatever it might be, but it's not indicative of my overall mental health. Now, had I gone through that questionnaire and actually marked some of those reds and oranges that I was feeling really low, what would come up are two options and pathways to support. I'm going to skip past the goals quickly, and I'm going to touch on those after. The first is that this Greensleeves care box at the bottom would pop up. Now, this contains all the relevant information to you to be able to get some extra support. So either through Medigold Health, through Samaritans, Mind, or Calm. These are different organizations you can go to with simply the click of a button. I'm taken through to the Samaritans website. All I need to do is call that number, or can have a chat online as well and get some extra support with them. Alternatively, I can use Mind or Calm as well to be able to get some extra support, as well as, of course, the Medigold Health support, which all Greensleeves care staff have access to. So that's the first route of support, the first pathway you put onto. The alternative one is that you can interact with our live coaching. Now, this is a live coaching therapy service, which is available to all Greensleeves care staff, which is as easy as sending a WhatsApp message to a team of qualified therapists overseen by one of our co-founders. And it's a tool which is available for you to be able to reach out and get some extra support. Perhaps you've been through the assessment, you've been told a word has been put onto how you're feeling, which might be depression, it might be anxiety, it might be something else. And you're given a pathway to go and get some support immediately from a therapist. And so in this example, I've reached out to Layla, one of our therapists, to share that I'd been feeling down and didn't know what to do. And within 1 minute, I had a response, which is our average response time is 1 minute, that you can start to put me on that pathway to support. And that can look like structured therapy sessions. It can look like just a chat and being signposted towards further support or to within tools within the app. And what we find is that in using this tool, people recover much, much faster, up to 80% faster to be on that pathway to support. Now, the recovery rates we also observe are around 50% higher than the NHS route into therapy through IAPT. And that's because it's more flexible, it's confidential, and that you can utilize these sessions, you can plan them at times that work well for you and work to your schedule, as opposed to having to take leave and the worries that might cause and having to go through that route. And so it's a tool which is there to work at your convenience, to run by qualified therapists with very high recovery rates through usage. And so you've got two great pathways to support. Once you've been through those assessments, once you understand perhaps some of the issues you're facing, you've got a therapist who's there to work with you between 8 a.m. and 8 p.m. Monday to Friday, which we are going to be turning into a 24-hour service within the year. And you've also got access to that support box as well. Now, I thought I'd just close on touching on a few of the other quick tools within the app. So we have the progress report, which is on that bottom row, and this captures all of your usage within the app. And so it's a very useful tool going into, perhaps say if you were to reach out to Medigold Health to get some extra support through your occupational health provider, you can show them your progress report if you want to. You can request a PDF form of this, and it's a long-term look at your mood over the time that you've been using the app. And so utilizing this, first of all, I can use it for myself in that I can look and see, oh, well, on the 24th of April, I had a good week around that time. And so what things did I do which helped me have a good week? And then I can look at the times where perhaps my mood was lower, and I can think what influenced it, what happened around that time. And I can start to take some action myself to try and do more of the things that improve my mood and less of those things that lower my mood. And I can also use it as a frame of reference for how long I've been struggling for. So that when I do speak to either the therapy team or a GP or an occupational health provider, that I'm actually very clued up about when this started, how long it's been going on for, and can really take out, get more high quality sessions in with those people because I've been keeping a record. And so it's a very useful tool to utilize, looking at that progress report, self-reflecting, and what more we can do. We also have the mood meter on the bottom right, which is an extended version of that self-assessment, which asks for some environmental factors. Perhaps it wants to know where you were when these feelings started to happen, what situation caused them. And it's another tool for you to be able to journal, to be able to narrow down what it is that's perhaps contributing towards your mental health issues. You also have the goals, which are programmed to you. The app has AI, which follows the tool and recognizes what tools you like to use and helps point you in the direction of using those tools more often. And so the app knows that I'd started the applied relaxation, and so it's recommending that I go back into continuing that to help with my anxiety. It's also recommending I improve my sleep and that I go and do something fun with someone. But say, for example, I've done this at 11 o'clock at night and there's no one going to be around to do anything with. I can change that goal to something more appropriate, as I can with all the other goals as well. And so the last thing I'll touch on is quickly in the activities section. We have a couple of different activities which are a bit more light touch. We have the message in a bottle feature, where you can go in and send a positive message to somebody in the Greensleeves care community, anonymous message, uplifting message. So I live near the seaside, so I'm going to choose the dolphin postcard. And you can send a nice message out to somebody just to lift their day a little bit. So I'm going to send a message to somebody in the Greensleeves care community, which is start your day by thinking of something good that's happened to you. If I don't press randomize, there we go. And I've sent that out with a pseudonym to somebody in the Greensleeves care community who's going to get a nice little message in a bottle, encouraging them to focus on something positive. And we also have the Wise Words game, which is a distraction word game, which encourages you to find positive words and rewards you for doing that. And what that does is it programs what they call a cognitive bias, where you're focused on looking for positives rather than negatives, and the rewards that come from looking for those positives. Now, the last thing I'll quickly take you through is the settings as well. And so if English isn't your first language, currently we have German and Portuguese languages in there. We are looking at rolling out Polish, Spanish, and a number of other languages, including Mandarin as well, over the next 3 to 6 months. We also have it so that you can have notifications turned on or off if you prefer not to have us speaking to you. Shake feedback is where you just need to shake your phone if you find a problem with the app, or you've got a suggestion or an idea you'd like to see. Otherwise, you've also got your user agreements down there as well. And the other important thing I'll highlight is the access code. And so when you first log into the app, you will be given an access code from Greensleeves Care to be able to access this tool for free. And that access code is Wellbeing Greensleeves 1, all one word, all uppercase, Wellbeing Greensleeves 1. And with the access code, you've got access to the full Thrive library of tools, the live coaching with a therapy team, and beyond as well. And so really, I'm again conscious of the time. That is the Thrive app in a nutshell. It's, as I said, a great tool to be able to help with your mental health if you're struggling, or to help build you some resilience and help prevent those mental health issues coming in, as well as a tool for other people around you. If you know and understand calm breathing and you see somebody struggling, you can help them by using calm breathing with them. If you're worried about a colleague, or perhaps as a manager, you're worried about somebody who you have responsibility over, you can use that live coaching feature and chat to a therapist and say, actually, I've got a member of staff I'm really worried about, or I've got a friend I'm really worried about. Could you give me some advice? And the therapy team are there to help give you advice, to help that person onto the pathway to support as well. And so the last thing I'll quickly touch on is just the confidentiality of the app as well. And so the app is one of the reasons we have the NHS accreditation, is because your personal profile within the app is treated as an NHS medical record. It's completely confidential, it's encrypted, which means essentially that it's locked, that people externally cannot get access to it. And it's also what we call aggregated and anonymized. And so any data you input into the app is anonymized, so there's no name attached to it. When you sign up, we'll never ask for your name, date of birth, or anything like that. And it's aggregated, so it's pulled into a big group of data. So I can't look up and see what Joe Blogs is struggling with. And so it's protected. It's treated as an NHS patient record, and it's not possible for me to pick out individuals and look at their data because it's locked and because it's grouped together. And of course, it's also independent from Greensleeves care. So your manager, your HR advisor, whoever it might be, don't have access to the data. This isn't something where they can go into a system again and type your name in and find out what you're struggling with. It's independent, secure, and well taken care of, just to alleviate any worries you might have about inputting some sensitive information in. But otherwise, I don't know. I think really we've just about covered off all the things we wanted to cover in this webinar today. I don't know if you've got any questions, Alicia, about the app or anything that you've seen.
I don't have any questions at this time. I think, no, it was really good. I've never used a live coaching, so that's really useful to know about. So no questions at this time.
Excellent, brilliant. Yeah, it means I've done my job well then, doesn't it? But no, yeah, as I said, that live coaching is a tool for yourself, and I've used it at times for myself when I've been struggling, because it's great to get that expert opinion on what the right pathway to take is. But also, I said, it's a great tool for people you're worried about. So, for example, a friend of mine, when lockdown first reopened, we got back together to play five-a-side football for the first time in 18 months, and being in the group gave him a panic attack. And so I messaged a live coaching and said, what can I do to help support him? And they gave me some great advice, and he's doing much better. And so it's a great tool to be able to utilize for yourself and others. But if there's no other questions, then I think we can end the recording here. And if you do have any questions, please feel free to reach out. You can get my details, or if you speak to your manager, any questions you've got can be forwarded on to myself, and I'll help address any concerns and anything like that. Otherwise, thank you so much for watching.